What should one expect during spinal surgery? Now, if you or your close ones have been advised to undergo a spinal surgery, obviously it's very common for you to have questions in your mind to think about when will be your admission, how long will be your stay in the hospital, what duration will be the surgery for, how will be your pain management, when will the sutures come out, and when can you go to work? All these questions, let's discuss about it. My name is Dr. Rakesh Thake. I'm a consultant spine surgeon working in Mumbai, and this is a new channel that we have started to spread spinal awareness amongst our English audience. So if you enjoy watching this video, please do not forget to like and subscribe the channel. So coming back to our topic, the very first important thing you should understand is why you made the decision to undergo spinal surgery. Now, this is a discussion that you need to have with your consulting doctor and understand what is the problem in your MRI scan, and does that scan findings match with your clinical presentation or your symptoms. Now, if they do or if they don't, what are your treatment options? Can you get better with just physiotherapy, or do you need changing medications? Is injection an option for you? Can you practice non-surgical decompression with more sophisticated physiotherapy, or is surgery the only option for you? Now, having understood all these treatment options, what are the pros and cons of each, and what is the right thing for you? Now, if you made this decision that surgery is the only and the right option for you to go ahead, then comes the next part of the video. So this is the discussion that you have made, having understood all the risks and benefits, and you weighed the pros and cons, and then you have decided to go ahead for spinal surgery. Going forward, we admit you a day before the surgery to investigate you for pre-operative fitness. What that means is, we send your bloods, we do your chest x-ray, ECG, 2D echo if needed, and then an anesthetist sees you to know if your body is fit to undergo anesthesia and spinal surgery. The other reason to admit you a day before the surgery is also to obtain consenting from you. Now, I don't really like to discuss all the complications on the day before surgery, because that just puts a lot of stress on the night before undergoing surgery. It would be nice if we discuss all this during the consultations that we do with you before the surgery, so that you have some time to think about it and take the best decision for you. So we do that a few days before, and then we talk to you about what are the risks involved, what are the benefits, and confirm that this is the right decision for you, and you sign the form that you agree with us, or you agree to undergo the surgery. Now, having done the pre-op investigations and signed the consent form, then you undergo the surgery, where most commonly it is performed in the prone position, where you lie face down, except in the anterior cervical spine surgery, where we keep you supine, or even anterior lumbar surgery, where we keep you supine. So this on an average goes up to 2 to 4 hours, can be less, can be more, depending on the case to case. The anesthetist gives you some medicines to make sure that your baselines are maintained. So when you wake up from the surgery, you might notice that you have a drain coming out of your back. It may not be there if it is performed minimally invasive or endoscopically. Other thing you might notice is a urinary catheter if the duration of surgery was longer. You may not have either if the duration of surgery was shorter, or if it was microscopic or minimally invasive. You will stay in the hospital for roughly around 2 to 3 days. We try to make patients stand and walk in few hours after the surgery if it's a simple microdiscectomy or endoscopic surgery. If it is a long procedure, complex with implantation at multiple levels, then we might need to give you a rest for a day or two and then make you stand and walk. Roughly your stay in the hospital would be around 2 to 3 days, following which you will be started with gentle exercises, mobilized by the side of bed, asked to do stairs if you have stairs at home, and then discharged with some physiotherapy advice. You come back to us at day 14 to remove the sutures. If we have used dissolvable sutures, I still like to see my patients at 14 days. And then from there, we take the discussion of how we should escalate your physiotherapy, how we should get your strength back in your core and back, and then going forward, when should you resume your work. Roughly that is around 4 to 6 weeks, and you pretty much then get back to your routine. So starting from the decision till going back to work, this is how your journey through spine surgery would be. If you still have any questions, then please do not forget to write that in the column below, and we'll do our best to answer those questions and help you as we get time. Thank you so much.